Omega-3 and omega-6 fatty acids, striking the right balance for heart health. As cardiologists, we are deeply concerned about the role of fats in health, especially given the current obesity epidemic. In maintaining a healthy weight, the type of fats we consume is important, in particular omega-3 and omega-6 fatty acids. These essential fats play a critical role in maintaining overall health, especially heart health, and achieving the right balance is important. Whilst both omega-3 and omega-6 are necessary for bodily functions, the modern diet, however, tends to be skewed heavily towards omega-6, which does lead to inflammation and related health issues. With omega-3 fatty acids, they are considered the healthiest fats. Omega-3 play numerous beneficial roles throughout the body. They are crucial for heart health, brain function, and reducing inflammation. Both omega-3 and omega-6 are polyunsaturated fats. So what does polyunsaturated fat mean? Essentially, these molecules contain multiple double bonds in their structure. Both omega-3 and omega-6 serve different purposes in the body. With omega-3 fatty acids, they have the anti-inflammatory property. It helps reduce inflammation in the body, which is linked to a variety of chronic diseases, including heart, arthritis, and certain neoplastics. Omega-3 fatty acids include ALA, EPA, and DHA, are a type of polyunsaturated fatty acid which are key for cell structure, inflammatory pathway generation, and metabolic pathways. EPA and DHA are found primarily in fatty fish like salmon, mackerel, sardines, and tuna. Another form called ALA is found in plant-based sources like chia seeds, flax seeds, walnuts, and soybeans. Omega-3 is known for supporting cardiovascular health by lowering triglycerides. It also reduces blood pressure and improves the overall heart health and function. Omega-6, although necessary for bodily functions like growth and development, excessive intake, which is now highly common in Western diet, does lead to chronic inflammation and unfortunately a risk of heart disease. So where are omega-6 found? They are found abundantly in vegetable oils such as soybean oil, corn oil. They are present in processed foods, meats from animals which are fed with grain-based diets. A key aspect of wellness is maintaining the right balance between the omega-6 and omega-3 fatty acids. The ideal ratio should be closer to 1:1, meaning 1 omega-6 to 1 omega-3. Unfortunately, many Western diets have a 20:1 ratio due to the overconsumption of processed foods which are rich in omega-6. The higher ratio is largely due to high consumption of refined seed, vegetable oils, and less consumption of omega-3 rich foods. Now, immune cells do use omega-3s in manufacturing signaling molecules that contribute in decreasing inflammatory pathways and ultimately contribute also to resolving the inflammatory processes. Omega-3s can directly decrease the activity of NF-κB, the master inflammatory pathway, and this can turn down an inflammatory episode. How can we improve this ratio? One can increase omega-3 intake by incorporating more fatty fish into one's diet, or considering plant-based sources like chia seeds or algae-based supplements if one is vegetarian or vegan. To reduce omega-6 intake, it is important to limit the consumption of processed foods and refined vegetable oils that are high in omega-6. In plant-based options, for those who prefer not to consume fish products, algae-based supplements can provide a vegan source of EPA and DHA. Olive oil has a unique role. Interestingly, whilst they are not rich in omega-3s, olive oil, particularly extra virgin olive oil, contains monounsaturated fat called oleic acid that provides heart protection. They are rich in polyphenols, which are a potent antioxidant and can fight inflammation and cellular damage. A recent study investigating the Mediterranean diet's role in managing atrial fibrillation, one of the more common sustained heart rhythm disorders, found that enriching the diet with extra virgin olive oil can reduce AF recurrences after catheter ablation. This piece of work involved 720 patients, and the trial compared people with a Mediterranean diet with those on their usual diet, tracking outcomes for over 18 months. The results here showed an interesting 10% lower risk of arrhythmia recurrences overall, with a significant 31% reduction in patients with paroxysmal atrial fibrillation. This highlights the potential of lifestyle and dietary changes to complement medical treatments to improve overall heart health. So is omega supplements a one-stop solution? Whilst dietary changes are the best way to achieve a healthy balance of these fatty acids, supplements in some cases can help. Fish oil supplements rich in EPA and DHA have been shown to provide cardiovascular benefits. However, not all supplements are created equally. If choosing a supplement, one would recommend buying from the highest quality of sources. There are numerous factors that need to be considered, including the dosing, type and formulation of omega-3 fatty acids consumed, age, gender, clinical risk factors, and atrial mechanical milieu in the individual person. Now, having a balance is crucial, and not overdoing one thing is important. There has been suggestions linking omega-3 fatty acids at higher doses causing heart rhythm issues. This graph illustrates that there is somewhat a sweet spot for omega-3 fatty acids intake. Too little of it or too much of it in both hands can increase AF risk. Now, we need to view wellness holistically. 5 elements into this include having a balanced diet full of whole grains, fruits, vegetables, and lean proteins. Staying hydrated is important for cellular health. Exercising regularly to maintain cardiovascular fitness. A good night's sleep. This ensures good recovery. And finally, practicing mindfulness to reduce stress.